When you are done with nursing school, the next thing you start thinking of is the NCLEX. Right? Now, is either you are ready to take the NCLEX exam or not. At this point, right, because you are done with nursing school, the only thing that is stopping you from taking the NCLEX exam now is either you are ready or you are not ready. Right? Now, there's one thing to be ready, and there's another thing to get the right result. Because me and you know that we have two results you can get from taking the NCLEX exam. Is either you pass or fail, right? If I should take a random guess, you are likely watching this video because you have failed the exam and you want to have a deep understanding about the exam in order to have the ability to pass, right? So, yeah, let's just proceed because I can help you out. So, stay with me. Now, in order to pass, right? Or if you are getting one of these results, either you are passing or failing, what is deciding any of these results is your preparation. It's your preparation. A lot of students like student A, we spend 30 days. Student B, we also spend 30 days. Student A can happen to pass after studying for 30 days, and student B can study for that same 30 days and end up failing the exam. Right. So it's your preparation that will determine if you are passing or failing. But there is a way you can prepare that will 100% lead you towards passing. And there's a way you can prepare that will also 100% lead you towards failing. Like there's a natural way of doing things that once you follow that process or that particular roadmap, you are guaranteed of what? You are guaranteed of what? Achieving that what particular thing. Right. There's a roadmap to passing, there's a roadmap to failing. The problem is not the roadmap. The problem is doing everything in that roadmap. That's the problem. Yeah, but that's not what I want to talk about. We can talk about that another time. Now, yeah, I said we have two results, either you are passing or failing, and then your preparation is the one that is deciding that. Now, in order to prepare, you need to follow this fourth step, right? One, you need to know about the exam, right, which is the NCLEX. Two, you need to understand the exam, which is understanding the NCLEX. Three, you now need to plan, right, related to the exam. And four, you need to now take action, right? Now, if you don't know about the NCLEX, you will not be able to create understanding, you will not be able to plan, and you will never take action. Now, the reason why a lot of students will start preparing for the NCLEX exam now, and right, and when they are getting closer to the date of their exam, they don't feel prepared, they don't feel ready, right? Or as they are studying, they keep on meeting what? Confusion. They still feel like they are not doing the right thing, they are lost. It's because they only know about the NCLEX, and from only that, they are taking action. The only thing most students know is what is the NCLEX. That is what a lot of students just know. What is the NCLEX? The answer to this is the NCLEX is a licensure exam that you need to take in order to become a licensed nurse. That is the what. Now, from what I just said right now, is it telling you what to do? Is it telling you what to do? The answer is no. because the NCLEX is a licensure exam that you need to take in order to be a licensed nurse. It's not telling us how to achieve that license. It's only just telling us take the exam, you are going to what? Be a licensed nurse. But in reality, in order to be a licensed nurse, you need to pass that exam. That's the first thing. You need to pass that exam. Now, you cannot just wake up and then say, oh, I will take the NCLEX exam and I'll pass. There are some things you need to understand, right, before you can achieve what? Passing the exam. So the definition or knowing what the NCLEX is not telling us those things. What will tell us those things is the understanding of the NCLEX. Now, that's why a lot of students struggle with the NCLEX. They don't know what they are getting it into. They only know what it is. It's just like, let me give you two examples. Let us say, your friend invited you to a party. Now, you said, oh, I'm interested. You attended the party, right? Now, guess what? You are not like, oh, it's very boring, right? The reason why it's boring is because you know what the party, you know what party means, right? Because naturally when you hear the word party, you are like, oh, you're about to have maximum fun. But guess what? You attended this party and you never enjoyed it. It was boring. You were tired, right? You want to go home. Right. The reason why you are experiencing this is the failure to understand the kind of party that you are going to. There are some certain party that will definitely be boring to you because you know the kind of party you like to attend. So there's one thing to understand what party is, right? That is knowing the what, which is what is a party, right? And also understanding the kind of party that you are going to. So you don't just want to know where you are going, you also want to understand. Because the moment you know that you are going to a party and you understand, you can make a decision if you are going or not because everything is clear. So you will not get to attend the party and then find that it's boring. That's what a lot of students do, right? They only know what the NCLEX is all about and they go take the exam, right? That is the reason why when they are answering question, right, on the NCLEX exam, they are lost, they are confused because everything look strange, different. They don't know what is going on, and at the end of the day, they end up failing. And who are they blaming? They are not blaming themselves. Instead, they are blaming the program. Now, I will explain I will explain program parts to you, but I guess not in this lesson, right? I will explain program parts to you because program part is like the tool you are using to solve an existing problem you already know, right? It's just like now you are sick, right? What would you use to solve this? That is going to what? The hospital, right? That's what you use to solve it. Now, it's just like uh you want to pass the NCLEX exam, right? What are you using to solve it, right? You just like now, you want to pass the NCLEX exam. What are you using to solve it? A program. Now, you are sick. What are you using to solve it? The hospital. Now, when you are sick and you go to the hospital, right? What will they do for you? They are going to do what? Assessment, right? To see what is wrong with you. Now, I want to ask you one question and I want you to be honest. How many programs have you gotten yourself into that did an assessment on you to see how to help you pass? Because you are sick. In order for the hospital to help you out, they need to find out what is wrong with you to help you solve this problem. Now, so if you have a program, right, the program as well to need to assess you to see how they can help you pass. But guess what? Many programs out there, even the ones with the big name, they don't assess you. You just get the program and you do everything yourself. So you need help. You cannot go to the hospital sick and start taking medication by yourself, like just going to where they place medication and start using any random medication. Somebody needs to help you, which can be the nurse or the doctor, right? Somebody needs to see you and start asking you what is the problem. But who is seeing you when you are taking a particular program, or when you are getting a particular program? Who is seeing you? Nobody. You are doing it yourself. So you need help. How would you end up now needing help and be doing it yourself? Right? So this way, you either will struggle through the process and pass, or you will struggle through the process and fail. So, because you need help. The whole goal of thinking I want to pass the exam and getting a program is because you need help. So, who is helping you to achieve that problem? Who is talking to you? Because the process of helping you or follow this same nursing step assessment, what is making you uh think you will fail the exam, or if you have failed the exam before, how can we help you to pass now? What is holding you back from passing? Right? And now the diagnosis is, I now know why you are failing the exam, and I can be able to help you out in passing the exam. Now we naturally now create a plan based on what we discover here. Then we implement that plan. The evaluation is after 60 days, you take the NCLEX exam and you end up what? Passing, right? Or the evaluation can start even right from the program, whereby you start taking what? Your practice test, right? And everything you thought was the problem before now has been solved, right? Just like one of my students who joined my program 2 days ago, right? And after she completed the first session, she was like, "Oh my God, thank you, coach. I now know how to answer prioritization question. I have been getting every prioritization question correctly." Right. The initial problem, right, she had, I was able to know that from assessing her. I knew the problem. I created a plan, right, which is helping out to solve or answer any prioritization question, solving a problem related to how to answer prioritization question. We implemented it, and the result is she's sending message to me telling me, "Oh, coach, I can now answer prioritization question. I have been answering every prioritization question correctly." Right. So this is what every program should be all about. And this is what I do when I am trying to like coach students, right? I don't just get you into something. I try to know the problem so that we can give the right solution to the problem. That's why I call myself the NCLEX doctor, right? Because I will try to understand you and give you the right solution. And once you follow the process, you 100% will pass the exam. Now, back to what we are saying, right? It's all about understanding than just knowing. Now, a lot of students know when they are done with nursing school, they need to get a program. That is what they know. But do you understand if that program is giving you everything you need to pass? Right. So it's not about knowing, it's about understanding. Now, knowing what the NCLEX is just by saying, "Oh, the NCLEX is a licensure exam." But understanding what the NCLEX is when you now start understanding that, oh, the NCLEX is an exam that tests to see if you are a safe nurse. This is one thing. They test to see that you are a safe nurse. Now, in your head, you are like, "Oh, okay. They test to see if I'm a safe nurse. How?" Right? Now, the how is using the 8 client needs. Then you're like, okay. So they test to see if I'm a safe nurse related to the 8 client need. So the next natural question that come in uh in your mind is, what are the 8 client needs? Right. So that I can start studying related to that 8 client need and show that I am a safe nurse. Right. But just knowing the definition by the NCLEX is a exam that make you a licensed nurse. We not tell you all these things, but the understanding we tell you all these things. There's more we can go with this understanding, but I just want to make it short. But at the end of the day, I know in your mind now you're already building the next question. Okay, they test us that they want to test to see if we are a safe nurse. We need the eight client need, right? That we need this is what you need to study to now start showing the NCLEX exam that you are a safe nurse. Now you want to know what is the eighth client need. That is your next question. Now, if I tell you what are the eighth client need, the next thing is, okay, how do I study related to this eighth client need? What do I need to study in each of them in order to be above the passing standard? That's the next thing. So understanding creates, right, a step-by-step understanding, right, a step-by-step process whereby you can start understanding everything all through. The definition will not create that step-by-step understanding. Now, a lot of students lack the understanding. Now, take for instance, let me give you a particular example. Now, let us say I want to give you a particular example, right? Let us say you have a bank problem. Let's say you have a bank problem, right? Now, and I want to tell you two things. Now, one, I just tell you, oh, you have a bank problem, and I just say, go to the bank. This is one statement. And another thing, I ask you, what is the problem? I ask you, what is the problem? You told me the problem, right? And I'm like, okay, go to the bank, right? When you go to the bank, then you will see a particular session called so and so. Tell them your problem and they will fix it for you. Now, which one are you going to prefer? You have a bank problem and I just tell you, go to the bank. They will help you to fix it because obviously it's a bank problem. It's not a problem related to hospital or any other uh, uh, area, but it's the bank, right? So obviously bank problem is solved in the bank. So I can be right telling you, go to the bank, you'll be able to solve your problem. I can be right to just telling you that. Now, but there's still a better way I can help you out. Instead of telling you go to the bank, instead I can easily ask you, what is the problem? You tell me what's the problem. I tell you, okay, all right, do this, go here, go right there, you will be able to get it fixed. Now, this, you will go to the bank, right? Yes, you want to get it fixed, but you will still need to ask further questions when you are even in the bank, right? You will need to ask more questions when you are even in the bank. True or false? Because you don't know what to do. You just you are there in the bank and you are like, okay, I am here to do this and that. What do I need to do? Like you are going to be lost, despite the fact that you're in the bank that can solve that problem. You're still going to be lost. But this, you will never be lost because you already know what to do. That is the difference between just knowing the definition or knowing what the NCLEX is all about, or just understanding it. There's one thing to know you can solve your problem in the bank, and there's one thing to know where to go to solve that problem when you are in the bank. So there's one thing to know NCLEX is just a licensure exam, and there's one thing to know how the NCLEX tests to make you achieve that license. So what you want to know is not it is not that the exam is a licensure exam. What you want to know is that the exam tests specific thing in order to make you achieve that license. So now, what are you using to fill um the space? Because this is you right here and this is the result you want. Now there's something you need to fill this space, which is your preparation, right? Knowing that the NCLEX is just a licensure exam that a licensure exam will not help you out with preparation, but understanding that the NCLEX is an exam that tests to see if you are a safe nurse related to the eight client need, right? And you need to be above the passing standard in each of these eight client need in order to pass the exam. Now you already know how to prepare because the first thing you are thinking is, okay, please tell me the eight client need. What do I need to study related to the eight client need? And yeah, everything starts making sense, right? So I just want to show if I'm not missing anything. But let me add this, right? The power of knowing the what and how, right? Knowing what you want to do is, oh, anybody's asking you, are you done with nursing school? Yes. Oh, you should take the NCLEX exam, right? Yes. Have you taken it? No. Right? Now, everybody know what you should do when you're done with nursing school, which is to take the NCLEX exam. But knowing what to do is not what will make you to pass the exam. It's knowing how to do it. Knowing what you want to eat and how to cook it is what will make you have food on the table, right? You might not even know how to cook it. You just want to know how to get it, right? By buying it, right? So, but if you are stuck with the what, you will never know the how. So, the what is like knowing just what that particular thing is all about. The how is now giving yourself a clear understanding on how to achieve that what. So, that is one thing I also want you to know. Right. Now, there's always a roadmap. There's always a roadmap to passing the exam, and there's also a roadmap to failing the exam. There's a roadmap. If you can follow the roadmap, you are 100% guaranteed to pass. If you can follow the roadmap, you are 100% guaranteed to fail. Let me just put passing right here and failing. Right, you are 100% guaranteed to fail. Now, it's just like if I have a Google map, let's say this is my phone, and I pull up a Google map, right? And I type in pass. Let us say pass is a location, right? And I type in pass in the Google map. Guess what? Let us say this is the location, which is pass. It will tell me that, oh, this is how I need to go to this location, right? Which is pass. So definitely this is a roadmap, right? This is a roadmap. So it is very clear that once we follow this through right here, we are 100% going to get to this location, which is pass. That is the same thing that comes to preparing for the NCLEX exam. There's a roadmap for passing, there's a roadmap for failing, right? If you follow it through, you will get to that result. The only thing that is stopping you now from getting to this location is one, maybe uh you need a ride in order to get there, but you don't have a ride. You don't want to walk your way up to the place, or you just feel tired. There's always something that is not getting you here. There's always something that is not getting you here. That is it. So in order to pass the NCLEX exam, right, there's always something that is not getting you here. I always used to tell my students, don't, you are overthinking the NCLEX because the NCLEX word is noisy. The NCLEX word is noisy. So don't pay attention to what's on the internet. Everything on the internet is complicated. There's only three things you should be thinking right now when it comes to preparing for the NCLEX exam, which is one, you want to take the NCLEX exam. What do you need to take the NCLEX exam? Is to read. That is what you need. Now, a lot of students have complicated this. When you want to take the NCLEX exam, you need to read. Right. So the next question you're asking yourself is, what are you reading? So what are you reading? Right? Create what? The content. So what are you reading? The content related to the exam. It's just like right now, you want to make money, right? You want to make money, right? In order to make money, you need to work. So the next thing you are now asking yourself, what kind of work can I do? Right? What kind of work can I do? Then you get your desired job. Right? Once you get the job, you do the work, you get to make the money. Once you know the content, you read it, you get to pass the NCLEX exam. Is that difficult? But a lot of students have complicated it. That's why I tell students, don't pay attention to the internet. Especially, I don't tell students to bring internet thing to me. A lot of students have complicated the process of passing the NCLEX exam. Now, the NCLEX now look like it is not doable. Now, the NCLEX passing rate is 88 to 94% for students who are taking the NCLEX exam for the first time, which means it's only 6 to 12% students that are on the internet complaining that the NCLEX is difficult. Because 88 to 94% is succeeding on the NCLEX exam. It means that we only have 6 to 12% students on the internet complaining the exam is difficult. So when you should remember that this is the pass rate, you are focusing on this and you are slowly bringing yourself from the ability to pass the exam, and you are gradually draining yourself down to having the ability to fail, because you are already detaching yourself by not having the right mindset, right? By paying attention to 6 to 12%, when 88 to 94% are passing. That's why I'm telling you, don't pay attention to what you are seeing on the internet. People say a lot of trash on the internet. If not, you will lose your focus from having this clear roadmap to passing to start walking through this roadmap. That is what I've seen for the past 2 years, because I've helped over 700 students pass the NCLEX exam successfully. 80% of this number were students who have taken the NCLEX exam multiple times. Right. Many students, right, struggle because of one of these things. I call it the CWU. One, the content. Two, knowing how the NCLEX write the question. Let me write this again. Knowing how the NCLEX write the question. Three, understanding. Right, understand. Now, it's one of these three things that is causing you to fail the exam. Guess what? You need to have everything in order to pass. Is it that you don't know the content, you don't know how the NCLEX write the question related to the content, or you don't know how to understand it? Right, it's one of these things. Now, every time I fix one of these things with any student, they have the ability to pass the exam 100%, like they always used to pass. These are students who have failed 2, 3, 4, 8, 9 times, 14 times, and they end up passing on their very next attempt. So sometimes before, when I started coaching, I'm like, oh, if I started, I had a particular student who failed 2 times. This is my first student, right? Later, I had a particular student who failed 8 times. So I was like, wow, if you have failed 8 times, you've used various programs, how can I be able to help you to pass? Because at that point, I was like, maybe I will not be able to help that student to pass. But when I realized that the power of understanding, let me create more slide, please. When I realized that the power of passing the exam all start from assessing the problem, knowing the problem, planning towards fixing the problem, implementing the solution, and evaluating the outcome of that solution. That was when I knew that a lot of program don't even do all this. That's the reason why a lot of students get into a program, they have problem, but they still end up finding the solution to the problem in that program. It's just like the program is like the bank that you go to, right? You have problem with your bank, you go to the bank, but you still end up going to the bank to find solution to the problem. Like you don't even know where to go. You are like, oh, you have this session right here, you have this session right here, you have this session right here, you have this session right here. So you are like, I don't even know where to get my problem fixed. Should I go here? Should I go here? Should I go here? Should I go here? But you are in the bank, right? So maybe this is customer care session, maybe this is cashier 1, cashier 2, like a lot of things going on in the bank. But the moment you don't know where to go, you have to start figuring out the whole thing yourself, right? But if someone tell you, oh, this is where you need to go, the customer care session to fix your problem, you just walk in there, right? But there's nobody to guide you in that program. You still end up finding the solution yourself in that program. It's complicated. That's why you need a coach that's going to help you walk through the process of understanding the exam. So when I implemented this, naturally, this is what I always used to do. This is what I wanted somebody to do for me when I was preparing for the NCLEX exam. I needed somebody to like assess me, know my problem, create a plan for me. Let's implement it and then see if I'm going to pass the exam, right? So that's why I knew this is how to help students pass. I did that for these students who failed 8 times. Because I helped the student to pass on a third attempt, but I was worried if I could help the student to pass, because I was like, okay, if you use this program, and you failed, possibly I might not be able to help you. But the moment I implemented those 5 key process, knowing a problem and fixing it, she passed on a very next attempt. I thought that was the best I will have in my coaching program. Not until I help a particular student who failed 14 times and passed on a 15 attempts. Right. When I did this, I knew I have everything possible to help any student to pass the exam successfully. Like, I have everything to pass, to help you pass the exam successfully. Right. Because if I tell you the story of this student, right, if you compare your story to this student, there's nothing stopping you from passing the exam. This student struggle with English. She's not from the US, she's from Philippines, right? She have taken the NCLEX exam 14 times. Many of these exams she failed in less than 75 questions, less than 85 questions. When the exam was 675 questions, she failed less than like she did not, like, she failed in 75 questions, not less than, like, 75 questions. She failed in 85 questions, right? Maybe 2 or 3 exceeded 85 questions, right? And she gave up. She told me it's because she don't understand English, that's why. But guess what? I told her the NCLEX exam is not an English exam. It's an exam of what? Concept. So once we can understand the concept, even if it's knowing that concept in your language, you still have the ability to pass. So we did this, we implemented everything, and she was able to pass on a very next attempt, right? So the ability to pass is there. You just need to follow the roadmap, right? Just do everything to follow the roadmap. So, as I said, you have the ability to pass the exam. It's just this 3 process, which is the NCLEX that you want to take, reading. That is the next thing. Okay, what do you need to pass the NCLEX exam? Read, open your ear and listen to me. Read. That is just what you need. Right. So the next thing you should be asking me is, okay, what do I need to read? Then I'm not going to tell you, yes, this is the content you need to read. This is the content you need to focus on for the NCLEX. Now, the problem right now should only be you don't know the content that you need to read, which obviously, if you join my coaching program, I will tell you the content, right? And you are not reading it at all, right? Is it that you are not reading it, you are not consistent, or you are not retaining information, you have problem with work and family, you cannot like mix studying for the NCLEX and family issue, like work issue together. Like, there's just something that is stopping you from achieving a perfect reading time that lead you towards passing the NCLEX exam, or you are not even understanding the content or something like that, or you know the content, you don't even know where to read the content. There's just one thing or the other that is making you not have a successful reading that will give you a good result, which is passing the exam. There's just one thing, right? So let me try to recap everything we have been saying so far so good, right? Everything is all about your goal, which is to pass. And in order to pass, you don't just want to know, right? You want to understand. Like I said, you don't just want to know you have a bank problem and you need to go to the bank. You need to know where to go when you are in the bank, right? So that you are not lost. So you don't just want to know the NCLEX is a licensure exam. You want to know the process that is involved when it comes to the NCLEX, which is one, the NCLEX want to test to see if you are safe notes. Two, the NCLEX test you related to 8 client need. Naturally, you are asking this next question: what are the 8 client need? What are the content related to the 8 client need? And how do I study for the content? How do I get evaluated when I'm done studying for this content and feeling that I'm ready to take the exam? Right. So let's stick to this side, which is the understanding. So that is what I want you to do, right? Try now to start understanding the NCLEX, right? Try now to start understanding the NCLEX. That is what you want to do. And once you have this understanding, you know, you naturally start knowing what to do. right? The ability to pass the exam all come from you, right, understanding the NCLEX exam, creating the right plan, and then taking the action, right? Because you have the plan now, you need to take the action. You want to get to this location, you don't know how to get there. One, what is your plan? Your plan is to get a Google map, right, that will take you right here. So you already have a good plan. You don't know how to get here. That's the first problem, right? You understand that that is a problem. How do you get here? That's your problem. Now your plan is to get a Google map, and the action is to now follow the location that lead you to this location. So that is how the NCLEX works. So yes, this is everything related to NCLEX understanding. So if you are taking anything with you after listening to everything that I'm saying, is that you need to start understanding that the NCLEX is an exam that tests that you test to see if you're a safe nurse, right? Related to the 8 client needs, right? So the NCLEX exam want to test to see if you're a safe nurse related to the 8 client needs. That's what the NCLEX want to test, right? So now when they test you related to the 8 client need, you need to be above the passing standard. There are results you can get above, below, near the passing standard. So once you have all these results related to this 8 client need, right, most especially you want to be above, you have the ability to pass, right? So our goal, right, from here right to here, is to understand this and this. Most especially, you know this already. I want to be a safe nurse. How do you be a safe nurse? Doing everything right. The 8 client need, you now want to know what are they, right? You want to know what are they and the content related to each of them, right? So yes, so that is what we need to know now. So next session, we are definitely going to talk about the 8 client need, right, and the content in each of these 8 client needs. So with that being said, I'm going to see you in the next lesson. Bye bye.